in Australia, we spend about 327 billion. So that's how much the care economy is worth. And we do know that, over the past 20 years, it's actually double. We only have a small population. We have quite a large continent. One of the problems, I guess, that we experience is the aging population.
We think beyond transactions. We really build trust, not only with our clients, but also with the care worker itself, which is become our partners. So our tech is fast, within minutes, as you say, but our strength really lies in local insights. Now, we're also sending care workers to overseas, and our first pilot project is to Hong Kong.
You're listening to the Katalis podcast.
Welcome to the Katalis podcast, brought to you by the IA-CEPA Economic Cooperation Program Katalis in Jakarta. I'm Sondang Sirait and I'm here with my co-host, Robbie Gaspar. Today we are looking into something that affects all of us, the care economy. From childcare, elder care to healthcare, the care economy makes up a huge part of the global economy. Yet it's often left out of the conversation when it comes to trade and investment. Today, we are looking at why it is so often excluded and what we can do about it. But first, let's take a step back. What is the care economy?
We're hearing more about the care economy because it's central to how our societies function and how they grow. The care economy includes all the paid and unpaid work that supports the health and well-being of people. Things like childcare, aged care, healthcare, and disability support. It's not just about formal or informal jobs, it's about a critical sector that enables other sectors to thrive. For too long, this work, mostly done by women, has been undervalued and invisible in trade and economic policy. But that's changing. Through trade and investment, especially under the Indonesia-Australia Comprehensive Economic Partnership Agreement, or IA-CEPA, Indonesia and Australia are unlocking new commercial and development opportunities in care sectors, from aged care infrastructure and nursing exchanges to edtech platforms delivering care-related training. Investing in the care economy means more than jobs. It means economic growth, better health outcomes, and greater gender equality. In fact, formalizing care work and reducing unpaid care work can help close employment gaps and grow the middle class across both countries.
That was Holly Kruger, Katalis Lead Advisor for Trade and Gender Equality and Social Inclusion. Across the region, investors are increasingly seeing the care economy as a high-growth, socially impactful sector that aligns with financial, governmental and societal trends. On this episode, we're joined by two special guests who believe in the value of care is finally being recognised. They also argue that care is becoming more complex and demanding new skills, innovation and investment. In the first segment, we are joined by Professor Irene Blackberry, the John Richards Chair and Director of Care Economy Research Institute at Trobe University in Melbourne. Susan Nio, Founder and CEO of LoveCare Indonesia, a digital marketplace for care professionals, will join us next.
Welcome, Professor Irene. Thanks for being on the show. Not many people know this, but the care economy is the largest and fastest growing industry in Australia. What are some key investments and changes happening in this booming sector?
Yeah, thank you, Sondang, for your time and inviting me to have a chat to you about care economy. So it is true that, the care economy in Australia is the fastest and largest growing industry. So in Australia, we spend about 327 billion. So that's how much the care economy is worth. And we do know that, over the past 20 years, it's actually double. So in terms of, I guess, the demand, it's going to be strong and obviously, it's going to go up. And in terms of, I guess, the key investment that you mentioned, obviously the government, the Australian government has invested a lot of funding. So at the moment, the proportion is about 8% of the GDP, so gross domestic products, and it is estimated by 2032 is going to increase by about 15% of the GDP. It is a significant chunk, I guess, of our economy. And I think it's changing the way, people perceive the care economy from a welfare issues to actually looking at it, in terms of the value and the economy. So government, for example, Australian government has put quite a lot of investment in the workforce, for example. So the aged care workforce back in 2023 has received an increase in terms of the minimum wage by 15%, so 15%. And again, it's a strong commitment. The government also provided some incentive for nurses to work in the aged care. Childcare, the early childhood education and care also experienced the same investment and commitment, I guess, from the government in terms of, making sure not only we are able to recruit the workforce, but also retain the workforce. So apart from that, we also have obviously investment from private sectors. A lot of the company has provided anything from the telehealth, telecom sort of company, private health insurance. They see the value of maintaining care.
From 8% of the GDP to 15%, that's a big increase. Could you go into a bit more detail as to the drivers of this growth in spending on the care economy?
In the scheme of things, we only have a small population. We have quite a large continent. So the country itself, the land mass is quite large. One of the problems, I guess, that we experience is the aging population. The largest proportion of older people is actually people over the age of 85 in the coming years. That's really drive the strong, I guess, demand and growth in terms of the need for better care for the population. And also because of this large geographical area, it takes a lot of work and it costs quite a lot of money to actually deliver equitable care for all Australians.
Professor Irene, you mentioned that the Australian government recently increased the minimum age for workers in the care industry by 15%. Could you tell us some of the reasons why the government decided to do this?
Well, a few years ago, the government did a royal commission in aged care. So really to dive into the issue around the quality of care for older people. And unfortunately, the findings was quite, I guess, alarming that, even the title of the report is called Neglect. So that even though the government obviously put quite a lot of funding into the sectors, and also the care economy is a highly regulated sector in Australia, it's clearly is still not enough. That the workforce is not skilled enough to manage the complexity of the care required. So to do that, obviously, the government needs to invest on education. So we do have free TAFE courses, we call it. So it's like a RTO. So the registered training providers organization. But also as part of that is to actually uplift, I guess, recruit people, make people more excited, I guess, to work in the aged care. That's part of the reason why, they do need to make sure that the wages, the salary is actually on par with what people can get, for example, if you work as a nurse in a hospital setting.
Professor Irene, regional and bilateral discussions, such as the one hosted by Katalis and the ADB in Jakarta in April, which you attended, are underscoring the need for immediate action to promote sustainable investments and integrate care into national social protection approaches. You've done research across the board. What trends are you seeing in Australia and Indonesia or Southeast Asia as a whole?
I think, as I mentioned before, I think we have experienced this demographic shift. And we have had that a lot of experience in terms of setting up a policy, delivering the care, trying to tweak the funding model. We have done it all, I guess, through trial and error in a way. So that's, I guess, put us in a good position to be able to share that knowledge, experience to other countries, like Indonesia, for example, where the population is still reasonably young. The other area that's obviously is quite obvious to me is that Indonesia is very blessed in terms of having the number of population. You have so many people, you have people everywhere, which is a good thing. So that's your source of the workforce, the care workforce. If you come here in Australia, we got so much land and only 27 million people. 27 million people, I think, equivalent to what you see in Jakarta alone. You pretty much, cram all Australians into one city in Jakarta. That's the comparison. So to me, it's no-brainer that, given the proximity of Australia and Indonesia, there's a lot of, trade exchanges that we can actually do to benefit both of countries.
Talk about research. CERI has done extensive research on technology and innovation in the care sector. What opportunities do you see for Australian technology in Indonesia, and what should Indonesian investors know?
I think one of the big areas obviously is around digital health at the moment. So we have experimented a lot in terms of, how to better deliver care. For example, with the virtual care. So as part of the work that we do within our institute, we have trial one of the largest Victorian virtual emergency department. And that model is now being rolled out, and benefit everyone nationally across Australia. So it's about 1,000 presentations a day. So that's huge. And the other part is, the potential of that model to actually being expanded. The second one, obviously, is about, any technology or innovation around older people. People want to live as long as they're possible at home independently. But there are other things, even simple things like, well, it's not quite simple, but, data. We have data everywhere. Nowadays, with, if we can use some machine learning, if we can use AI, for example, and this is what we do now within the institute, and we work closely with industry partners, with health services, with aged care facilities, to actually try to use the AI, apply AI into the data, and trying to generate, not only in terms of the trajectory of care, but also in terms of data decision making. Like looking at the predictive sort of factors and ways that, we can actually do preventive care or care closer to home better.
You've suggested that there could be growing demand for in-home care services in Australia, particularly in the face of already critical needs in elder care. With Indonesia's interest in mobilizing its care workforce to Australia, what could each country consider as next steps?
This is a good question. In Australia at the moment, 97% of older people live at home in the community. And the current government policy actually encourages even people to live longer at home. There is a new Aged Care Act that will take in place from the 1st of July. So that's the funding mechanism for Australians to access aged care services, both at home and also in residential care or a nursing home. But also there is a special program called Support at Home. But the problem is, as I mentioned before, despite the fact that the Australian government put some allocated some funding, we don't have enough workforce. And I think this is a great opportunity, obviously, for Indonesian care workers, to actually come here to Australia, to come and also to work. The problem is, I guess, the aged care sector is highly regulated here in Australia. We do have quite a stringent, not only in terms of, how people needs to register, but also how people receive the education and training, and there needs to be credential. This is where I think that it requires both countries to actually have a partnerships whereby the Indonesian people, the people who would like to work in the care sectors in Australia, can receive an education and training, that can be recognized and also credentialed according to the Australian standard. I think that is key and critical in terms of, not only how people can actually access the same level of education, but also there are other ways, I guess, that can help to facilitate that. One of them is, for example, by having this, we call it living labs. So it's mimicking, an environment, a house, for example, where older people live here in Australia. So once you've got attained the education and being able to show that you are able to work in the Australian setting, I think having a mechanism and a way to find an employer here in Australia who can then employ the person, but also a way, I guess, for the Indonesian care workers, to actually have that experience working in an Australian environment or Australian setting. Because obviously the cultures are different. Australia now has becoming quite a multicultural society. If we look at the aged care workforce in Australia, about 40% are actually born overseas. What I'm trying to say is that, so not only, I guess, the clients are diverse, but also, the workers are quite diverse here in Australia. Education and training is one thing. I think understanding the culture and about, how to work, the way of working is different in Australia.
Within the IA-CEPA, health and skills are priority sectors, and Katalis has been progressing bilateral agenda in alignment with these sectors, including by promoting standardization of the nursing profession. Now, what more could be done to fast-track efforts to meet the pressing demand in Australia?
I think that, having that education from an Australian organization, obviously, that would help greatly. But also the other part, apart from having that visa, is also supporting the workers, not just, I guess, sending them here, to Australia, but also making sure that they are actually well supported. And that's an important part in terms of the workforce, not only about recruitment, but also about retention.
You would agree that both Australia and Indonesia urgently need care models that are not only affordable and accessible, but sustainable and suitable for the local context. What advice would you offer businesses looking to enter these markets?
I think the first thing is to understand the market, to understand the local needs. I think that, when you talk about home care, for example, home care in Australia, the model is way different to home care in Indonesia. There are obviously common areas that would go well across both countries. But I do know whatever, I guess, model or whatever training that we do, it needs to be customized, it needs to be tailored so that it fits for purpose. But obviously things like, for example, like technology, for example, we do not want to reinvent the wheel. I think increasing that accessibility in terms of the knowledge, the training, the technology, but also making sure, I guess, adapting that to the local context, I think it's important. The other thing I think that people often not, I guess, really put their mind into is that, this is a dynamic sector. The needs of people will change over time. Whatever is good now, it may not be good in the 5 to 10 years' time. It is important that we also assess the quality. So in Australia, we have quite a lot of these quality indicators. Hence, it's a highly regulated area because we want to make sure that the delivery of care is safe. Whether you use technology or whether, you train people to do certain things, you want to make sure that they're being trained properly and they're supported to actually deliver the care appropriately to, I guess, person-centered care, what matters to the person who is receiving the care.
Ibu Susan, welcome to the Katalis podcast. We are very happy to have you with us.
Good morning. Hi. Thank you for having me today.
So let's start right away.
Right.
In Indonesia, there is a rising wave of investment in the care economy. Indonesia's silver economy is projected to reach $7.5 billion this year. And by 2030, it is set to become the world's second largest after China. That is an unprecedented transformation. What does it mean in the near future, though?
Okay, maybe first thing first, Indonesia is home to more than 31 million elderly citizens today. So it's about around 11% of the population. And that number will only grow. So this shift is not just about demographic, it's about economic. So obviously, the rise of the silver economy means elder care is becoming a driver of new jobs, new services, and new innovations. And it's a chance to turn care into a key pillar of inclusive and sustainable growth.
Awesome. Susan, I just wanted to ask also, how does Indonesia's policy framework encourage private sector involvement in building an effective care system?
Care is increasingly recognized as a strategic sector, fortunately, and one that requires strong cross-sector and cross-ministerial coordination. The government is laying the groundwork through national roadmaps, caregiver certification schemes, and standardized training programs. But at the same time, it's opening the door for private sector collaboration, particularly in bringing fresh ideas, digital innovation, and scalable solutions to strengthen the care ecosystem. Because as a private sector, you can be more agile and you can maybe have the resources and the budget and the energy to really focus on building up the innovation. That's how I think the private sector can collaborate with the government.
Now let's talk about your baby, LoveCare.
My baby. It's a toddler now? It's a toddler now.
It's a toddler now, okay. So your company, LoveCare, stands out for creating a care model that meets modern challenges with cultural sensitivity, such as providing elder care, but at home.
Mm-hmm.
In fact, your platform matches clients with their perfect caregiver within minutes.
Mm-hmm.
As a company, how do you remain agile and ahead of the competition?
Okay, I think we think beyond transactions. We really, really build trust, not only with our clients, but also with the care worker itself, which is become our partners. So our tech is fast, within minutes, as you say, but our strength really lies in local insights, continuous caregiver upskilling, and also on a platform that designed to adapt to real-life family dynamics. We keep listening to the critics from the employers, from the caregiver itself, and even from the clients. And from them, we get the very constructive, development to improve our system.
If you could go back a bit, how did you get the idea to start this company?
Well, it's a long story. Okay, we started this from personal experience of each founder. We all felt that at the time, it's very difficult for us to find reliable care workers. It's not that we cannot find care workers. It's easy. But that reliable care workers, and also at the time, how can this care worker can be guaranteed and also trained and professional to take care of our loved ones? At the time, almost impossible and quite challenging to find one. And it's a headache, really, to find one care workers. So that's how we started this. And then we think that why don't we use technology to find the reliable care workers. At the same time, we help them to find decent work and with decent pay. And then we use the technology at that time. And until now, I'm also the developers. So I built our very first MVP applications, and then we try it out and it worked out. And then that's how our team grew, and then we built up the system, make it better. Yeah, that's long story short.
That's amazing, huh?
That's awesome. You seem very passionate about what you do. I can just tell in your voice how passionate you are about the care economy. So it's awesome.
Mm-hmm. Ibu Susan, you've also advocated for a whole of government and whole of society approach with the private sector playing a key role in driving innovation and delivering care from the ground up. Could you explain more about your vision?
I think, and we must all admit that care is everyone's responsibility. Caring for people should not be left to just families or the government or the private sectors because it's tiresome. And even if you can do it, it's very, like takes all the energy and it will be very slow. And everyone has a role. Government can create the rules, the roadmap. Businesses can bring new ideas, innovations, solutions, and communities can provide support. And when we work together, care becomes stronger, more fair, and more sustainable.
Awesome. So I was going to ask you, workforce quality is key to ensuring effective care, whether elder care, healthcare, or childcare, but it can be a real challenge in Indonesia to find reliable carers. How does LoveCare address this issue and build a skilled workforce?
Okay, we focus on quality at every step, really from true creations and then training and then smart matching. And we don't just recruit, we really equip the caregivers with the skills, values, and mindset to deliver safe, compassionate, and professional care. Because caring people is not easy, it's tough. You really not only, you don't need only competence, but you have to have the empathy, the care, the feeling that you want to take care of the other people besides your own family. So we really focus on that. And this builds confidence for our families as our client and dignity and pride for the caregiver themselves. Because of this, they can get decent pay and decent working environment. And then they can probably say that, okay, I'm the caregiver.
So are you thinking with LoveCare expanding, sort of in the near future, making it bigger?
Yes, as long as it can share the value that we envision. At the same time, which is very important for us, is that we can upskill the care workers' dignity, such as the decent pay and the decent working condition, as long as it's possible to fulfill. And in fact, now we're also sending care workers to overseas. And our first pilot project is to Hong Kong. And it's working. All of our caregivers being employed.
Do you see like the sort of the care industry, an industry where people actually want to go and work in? Have you seen a growth in that sort of industry, like from people like sort of wanting to sort of become caregivers?
That's what we are. That's why I'm saying this is not only the demand that you have to focus on. You also have to really focus on the environment for the supply, which is the care worker itself. And that's why the care workers really like and love to join as our partners, as a care workers, because we really think about that. How to make it fairer, make the system good for them, and then how to smart matching them based on their competence and the quality. So because of that, the risk of them being bullied, or being scolded by the employers is lower. We provide the system where they can easily withdraw the fee by themselves and all through online. You don't need to wait for the employer to, give you cash as a payment, which is what the traditional or conventional way happening, right? So for us, we are very confident, and even for now, we don't recruit from those people, graduated from the vocational school or from the nursing background. We don't even need to do that. Everyone, as long as you want to be care workers, you can join us. As long as you want to be curated, you want to be trained, and then you want to follow our SOP, then you can become a reliable care workers.
Just how big is your workforce at the moment?
For now, I think it's about 7,000. It's quite small.
I was going to say that's quite big.
Oh, really? No, it's quite small for us. I think that we need more, since more of Indonesia is archipelagos, right? Archipelagos. So for now, it's not balanced yet. The care workers tend to be on the Java area, while our vision is that we would like to be able to provide care from even to the furthest region of Indonesia, which is happening though. Only, I think, a couple of cases where my staff told me that, Ibu, do you know that we actually send care workers from Bandung to Papua? So our client is in Papua. And then he really needs care workers to take care of his parent. But then in Papua, how can you find care workers? So through our apps, And then turn out in Bandung at that time, there's a care workers that, okay, I'm willing to go there because the payment is okay. And also the patient's condition fit my competence. And the smart matching happened. And the care also delivered. That's what we envision.
Probably this is a great segue into this next question. I think you'd probably agree that both Australia and Indonesia urgently need care models that are not only affordable and accessible, but sustainable and suitable for the local context. What you were mentioning just before as well. But what advice would you offer businesses looking to enter these markets?
Understand the people first. Care is not one size fits all. Learn how families in Indonesia live, what they expect, and what matters to them. And also, it's also same applies to the care workers. Build your service around that, your value around that, then you will grow the right way. So it's not about bringing the global model to Indonesia. It doesn't matter. Even, as a tech company, we have ever once tried to make it like fancy technology company, right? We will build AI system to smart matching the care workers and the families. They don't care, turn out. So it's not about bringing the most advanced or the most, the best system globally and then come to Indonesia and then, okay, we have the best system. No, it won't work. So from what we learned so far, you have to understand the people first.
Awesome. Thanks so much for your time, Susan. It's been really insightful, and I really appreciate you giving us a rundown of what you're doing and all the great work you're doing in the care economy. I think it's awesome.
Thank you, Ibu Susan.
My pleasure. My pleasure. My pleasure. Thank you for having me.
You've been listening to a conversation with Susan Nio and Irene Blackberry. We hope you enjoyed this episode. For more resources on Katalis work in the care economy, please visit our website, IA-CEPA-Katalis.org. You'll find a special section on economics of care, as well as a blog interview with Professor Irene Blackberry and other care champions. And as always, you can find us on social media. We look forward to you joining us again for the next episode of the Katalis podcast.
Katalis is a unique 5-year government-backed business development program that unlocks the vast potential of economic partnerships between Australia and Indonesia.